Yeah, Tulio Grajeda?
Yes.
Yeah, this is Jeff with the YouTube channel DSH Abuse and the website DSHABUSE.org. Today's date is August 31st, 2020. Can you spell your first and last name for me?
Tulio as Tulio, Grajeda as Grajeda.
G-R what?
Grajeda as Grajeda.
Okay, and you're a patient at Patton State Hospital?
That's correct.
Okay, and you consent to being recorded?
Excuse me?
You consent to being recorded?
Yes.
Okay, thank you. What is your commitment status, Tulio?
My commitment status is 1026 NGI, not guilty by reason of insanity.
Okay, and how long have you been at Patton State Hospital?
I've been at Patton for the past 7.5 years.
Okay, 7.5 years. And are you familiar with what your diagnosis is?
That's correct.
I mean, okay, what is your diagnosis?
Bipolar.
Okay, and what medications are you on?
Risperdal, 2 milligrams.
And okay, and do you feel your medication has stabilized you?
Yes.
Okay, and you're high functioning. You consider yourself one of the more high functioning patients on your unit?
Very high functional.
Okay, and you do artwork every day and that sort of thing?
Yes, that's correct.
Okay, you recently had coronavirus, correct? You were tested positive?
That's correct.
Can you tell me a little bit about that?
At first, when it first started, to my knowledge, was that people in the other part of the building, this is a big building where it houses 450 patients, and a west side wing of the building, people were getting sick of the coronavirus, and then
you're on west
we were
side,
afraid
right?
that was gonna transfer to other units as well, because
right.
Staff from those units that were the patients were actually ill by this virus. In fact, that staff was bringing it in, and then they keep mixing the staff that was in those units, bringing it to the units that they didn't have no corona.
Right. So the staff were mixing, going back and forth to different units, right?
Exactly.
Right. And one of those staff that was positive worked on your unit?
Yes.
Okay. And you came in contact with that staff member?
Yes, I did.
Okay. And so you tested positive?
Correct.
Okay. And so, are you the only guy that tested positive on your unit? I guess they ended up testing your whole unit, right?
I'm the only one, yes.
Okay, but they tested your whole unit? You guys went on quarantine?
Everybody, yes, like 3 times.
Right. Now, you ended up going to the coronavirus unit that was EB11?
That's correct.
Okay, can you talk to me a little bit about what the conditions were like on EB11? So, real quick, so before we get to that, this was about a month ago, correct?
Yes.
Okay, how long you been? So you went to EB11 about a month ago after testing positive, and you were there for how long?
For 16 days.
16 days. Okay. Can you talk to me about what the conditions were like on EB11?
EB11 represented a kind of like a death threat to me, to my knowledge, because people were really. Some of them were really ill, and they were dying, officially dying. They pick up the body, put them in a body bag, and take it in an ambulance and take it outside.
Did you actually see somebody? Did you actually see them?
Yes, of course. I see this. I see all this happening.
You saw somebody put in a body bag?
Yes.
Okay. Wow. Wow. Okay. But you said you felt the staff were taking pretty good care of you over there. The nurses were pretty conscientious.
Yes, the nurses and a couple of doctors assigned to the place was actually really trying to do the best of their ability in order to perform their duties as what their profession demands. And by them being in the front line, I really appreciate that very much from them.
Yeah.
And to my knowledge, they were trying to do the right thing.
Now, let me ask you something. Did you actually get to see the doctor every day? Did the doctor actually come on the unit?
There was a medical doctor on the unit permanently every day.
Okay, so that's interesting because it's my understanding at Kalinga, they're not seeing the doctor every day, but I'll have to check that out. So the doctor actually would come on and examine the patients. He would come and talk to you. Would he put his hands on you and examine you?
Not exactly. But he was just stay in a nursing station and do his paperwork. And he was assigned to that unit, and he luckily that the man was there. So whenever we have a little whatever going on, he would be the one that you can talk to.
Okay, but would he come out and talk to you if he needed to examine you or something?
Yes. He
would come out and examine you.
He
okay,
will,
so he was there.
He will.
Okay, how many patients were on that unit? Do you know?
It was total amount of 21, 23.
About 21 patients?
25.
Okay.
And so that's how the number of patients being there, and within the time that I was there.
Okay. Another thing I want to ask you about is you told me you were not allowed to make phone calls except to designated family members on a cell phone, and the regular phones were you were not allowed to use those. And they told you could not call your attorney. So I want you to address that real quickly. So first, the regular phones, you were not allowed to access them, correct?
Exactly.
And nobody could call you, correct?
Correct.
No inbound phone calls were allowed?
No.
Okay, how do you know that? I heard the phones were off the hook. Is that true?
The phones were off the hook, and nobody was allowed to pick them up, or they will rough them up.
What do you mean they would rough you up?
They will rough it up. Yeah, they will have a special team. Just get ready to go in there anytime. Gear up like looking at GI Joes with a suit, getting ready to go in there anytime anybody gets real loud or at least start to present some kind of manic features. They will come in and handle them.
Did you ever see people come in there and do that?
No, it was not necessary because nobody acted out for the time I was there.
But do they have what you call
like
GI Joe?
They have a team of officers ready to come in to handle any situation at any given time if somebody has started acting out. They have a strap bed too, a bed with the straps that they will strap anybody down on a bed if anybody start acting out. But
have you seen that in other units, like these GI Joes come in and rough people up?
Well, I've seen it before in some other units that they have it. They do come and rough people up really bad.
Yeah.
In fact, I'm one of the victims here that happened when I first got here to this hospital. It happens that I got into some altercation with some of the officers and some staff, and it was like 12 or more of them, and to the effect of that, I ended up losing one of my front teeth. I have a gap in my mouth now because of them. They knocked my tooth out with one single punch.
Right. Oh, they punched you in the mouth? They punched you in the mouth?
Yeah, they punched me in the mouth and dropped me on the floor and started roughing me up and giving me some booty shot that they want to give me though. To calm me down supposedly, but it was not.
Okay. So how do you know that if you touched those phones they were going to rough you up? Did they tell you they would rough you up?
Yeah. They will make sure secure that part that they wouldn't want to allow nobody to call in or phone calls going out from the public.
But did somebody tell you on EB11 that if you touch those phones we're going to rough you up? Did anybody tell you that?
Not in those words exact, but in so many words, yes, that's what they referred to.
Can you tell me what they said exactly that made you think that?
Well, they say nobody can use those phones. If anybody start acting out, trying to be funny about it, they will be handled.
Okay, you'll be handled. Yeah. Okay. All right, I just want to be. Okay. Now you were allowed to make phone calls to your. They made you pick certain family members that you could call. They made you make out a list, correct?
Correct. You can pick 3 choices.
3 choices, but you couldn't be your attorney.
But no attorney, no legal phone calls, except for family members, immediate contacts in case of emergency.
No legal phone calls?
No legal phone calls at all.
They said that?
Yeah.
They said no legal phone calls?
No legal phone calls.
You remember who told you that?
Yes. Kathy, the social worker in there.
Kathy, the social worker.
Yeah.
Do you remember her last name?
No last name. Just,
they don't. Yeah, they don't tell you their last names over there.
No, they always keep that concealed. Yeah.
Okay. Okay. The last thing I want to ask you about is prior to going to EB11, there was you told me there was methamphetamine on your unit 27 and 26. There was a lot of that going on. Can you talk about that a little bit?
Yeah, I became aware that something like that, activity like that, was was happening on these two, on the two units that are together, and it's just like an epidemic. Like I say, people tend to enjoy their moment, and I guess engage in some kind of a activity that has to do with those substances, and therefore, if they have it, they will use it. And you
used to use, but you don't use anymore, right?
No, I never use. I don't use at all. I have never engaged in an activity of it has to do with substances.
So how do you know that it's going on? You can tell by people's behavior.
I know. It's obvious. I'm pretty popular around here, and I have a reputation when it comes to my name.
Did people offer it to you, that sort of thing?
Exactly.
So it was offered to you. Okay.
Yeah.
All right. And I'm sure you don't want to. When
it comes to situations like that, it's always, unpredictable.
What's that?
It's unpredictable when that kind of environment.
Yeah. Okay. But it was offered to you and that sort of thing, right?
Right.
Okay. All right. Well, listen. Thank you, Tulio. And listen, if anybody, you have my information, I'm going to call you. We're going to cut this recording. I'm going to call you right back. Okay. Don't go away. We're going to end this interview, and stand right there. I'm going to call you right back on this number. Okay.
Okay.
Okay. Bye-bye.
Bye-bye now.
Bye.